Okay, so welcome. This is Good Food on Earth, and I'm joined today by Dr. Pam Popper. She's the co-author of Food Over Medicine and the author of Solving America's Healthcare Crisis. And she's the founder of Wellness Forum Health, Make Americans Free Again. And she has a new book coming out called COVID Operations. So today I wanted to bring her in and talk about some of the foundational stuff behind uh, COVID to give an understanding of what we're dealing with. So to start off, I wonder if Pam, if you could talk about coronaviruses in general, like kind of the backstory of what they are, the family of them, what does that mean in terms of immunity, and are they fatal normally to a certain group of people?
Yeah, well, coronaviruses have been around for a long, long time, and almost everybody who's been around for any time has got one of them. Most of us have antibodies. In fact, we have a pretty good evidence right now showing that if you've had another coronavirus, which could have been the common cold, and I don't think you're going to meet many people over the age of 6 months who haven't had a cold, right? I mean, this is just they call it the common cold for that reason. So that's a coronavirus. And so people who have had a common cold have pieces of antibodies and T cells and that sort of thing that confer some immunity to COVID-19, which is why we're finding so many asymptomatic people out there who are testing positive, like on serology tests. But the reason is not because they have active infection and they're sick. It's because they had enough immunity from prior coronaviruses to have some protection against this one. And that happens every year, by the way. You know, every year there is a seasonal flu. And every year people get sick, and we'll talk about the vulnerable in a minute, but every year people get sick, and then every year most people don't get sick, okay? So I'm good for a flu bug like every 6 to 10 years, and I recover from it real fast, you know, and then I don't get it for 5 to 9 seasons, right? Why is that? Well, I'm just not vulnerable. And usually, and by the way, every time that I can remember in the last 25 or 30 years that I've gotten sick, it's because I was run down. You know, it's one of those things. I got sick after we moved into this building because it was under construction and it was costing a fortune. And, you know, that's when you get sick during flu season. Under normal circumstances, you don't, right? So most people don't get sick. So it's not, we've terrified people about essentially what's no different than seasonal flu. And it's unconscionable that we've done that because it is no different than seasonal flu. And there are some studies showing the mortality rate is actually lower than seasonal flu.
Right. And I think it was early on, I found a video from Professor Dr. Sujarit Bhakti in Germany, and he was talking about how coronaviruses they can contribute to the death of some people normally. So is
Mm-hmm.
this like out of, are we talking about this virus being way out of the normal, or
Yeah.
is it kind of considered like,
No,
do
it's
people
it's the
forget?
same crowd always. And here's the first thing to understand is that everybody's very concerned about what happened in nursing homes.
Mhm.
And there are lots of reasons to be concerned. The biggest thing, in my opinion, is shutting off those people from all human contact. But we can come back to that. But when people move into a nursing home, nobody aspires to end up there. All right. Have you ever met anybody in your whole life who says, I'll tell you what, I am working really hard to save my money, in fact, so that I can end up in a nice nursing home because that's where I want to be. How do you end up in a nursing home? You're sick and frail. All right. And the lifespan of a person who goes into the nursing home under, if you go in June, which is not flu season, it's not very long. It's much shorter for men than women, but you're talking about 6 to 24 months or so.
Mhm.
So what happens is, and I think David Katz, who is a colleague of mine speaking at our conference this year, he has a wonderful way of putting this. He says, if you've gone into a nursing home, you have a short life expectancy. And what happens during flu season is that that's the thing that takes some people out who are going to be taken out anyway. And he doesn't mean this in a callous way. Every single time somebody dies, it's a very meaningful thing to the people around them. Okay, so when we talk about death in a statistical manner, I think it's really important to understand that I can talk about death in terms of statistics, and I can still be devastated when somebody close to me dies, right? And so I don't want people to misunderstand that. So, so here's the thing. If you take a look at the tiers of ages and then where these people happen to be, it's elderly people with comorbidities in nursing homes. And when you bring the age range down a little bit, because I'm 64, all right. So theoretically, I'm on the cusp of that, what they would consider a vulnerable population. But being normal weight, no drugs, no diseases, nothing wrong with me, I'm not very vulnerable to this. Now, somebody my same age who's 50 extra pounds, type 2 diabetic, medicated for diabetes and hypertension, same age, living in the same city is much more vulnerable. So I think one of the things I would tell everybody is if you wanted to take a productive lesson, something constructive out of this whole thing, you can you can pretty much prevent yourself from ending up in a nursing home. And there's no reason to be 64, type 2 diabetic and hypertensive. You can prevent that from happening too. And then you won't be vulnerable to this or other bad things that can happen. I mean, all kinds of bad things happen to people who are overweight, sick, and frail. All right. And all of that's avoidable. And that's where we should really be focusing our attention.
Mhm. And I wonder, since we were talking about people who are vulnerable and who have been listed as COVID deaths, if we could address what does it mean to die with something versus from something, and what have you noticed about the reporting of this since the pandemic has been declared?
Well, the reporting, the first big concern over the reporting was when Mrs. Birx, I understand she doesn't have a medical license anymore, looked into the camera during one of the White House briefings and instructed doctors to complete death certificates. Anybody who tested positive with COVID, even if the test was done post-mortem, would be labeled as a COVID death. And reporters aren't very curious right now, but that even caught the attention of one of the lazy White House reporters who said, you mean you're going to label everybody like somebody gets hit by a bus and tests positive? Yep, that's what we're going to do. And I mean, it doesn't get any more plain than that. A lot of times when you start talking about this stuff, everybody says, oh, you're a conspiracy theorist. Well, you can go watch, this is still on YouTube. You can go watch Mrs. Birx tell doctors to do that. So that's what they started doing. And what's happened is a few things have happened. The first thing is that family members who have found out that a death in a family member was erroneously coded as a COVID death have started screaming and hollering. And every time they do, they hurry up and change the death certificate. And in some states, in the United States here, these changes have been significant. And I'll use Colorado as an example. What happened, what triggered this whole event was several people who had family members in nursing homes die, received letters from the nursing homes that said, we wanted to notify you that when your grandfather, whatever it is, died of heart disease, we put heart disease on the death certificate, but it got changed and it was targeted as a COVID death. So the people who got these letters were justifiably pretty upset. So they contacted their elected officials. And one of the state legislators actually threatened the health director at the time that he was going to go after, I can't remember if it was a man or a woman, but for criminal prosecution. And very quickly, then all the numbers get adjusted and all the death certificates go back to what they were originally coded for. And all of a sudden you have like a 20% drop in the death rate in Colorado. So, and this type of misbehavior has gone on in Washington State was another one. And some of this stuff, it actually would make good comedy if these people weren't serious about it. The emperor of Washington State, forgive me, I don't call these people governors. They're not elected officials anymore. They're not acting like elected officials. They're acting like the ruling class, and they have no concern for their citizens. Believe me, they don't. So the Emperor Inslee got up there one day, and the essence of what he said was they were going to phase in telling the truth about the deaths. Apparently, this like sudden telling the truth. Well, first of all, apparently you cannot tell the truth for a while, and that's okay because there were no apologies or anything, But actually, when you decide to tell the truth, you can't just like flip the switch and start being honest. You need a phased in program over a period of several weeks or months where every week we get closer to the truth. I mean, this is so ludicrous as to, I don't even know what to say about it. It is so ludicrous. And people watch this, some of us like you and I, and say, this is insane. And other people watch this and say, oh, he's doing a great job. He's saving lives. You've got to be kidding, right?
And is there like something against medical ethics to mislabel on a death certificate? You know, if you don't make that distinction of something, you dying with something, but you say it's from, is there something like that in medical ethics?
Well, there are guidelines for this. You know, there are guidelines in medicine, and I think the first thing I want to say is that you know you shouldn't have to have a guideline in writing that says we're going to tell the truth about things. Okay, I mean, I don't have a sign in my store here saying stealing is against the law. And so people don't come in and say, well, there's no sign saying I can't steal, so I guess I'll just walk out with stuff, right? I mean, so the first thing is I think we have to get away from the idea that lying on a death certificate is a good idea in some cases, because it's not. And I think the second thing is the vast majority of health professionals who I know are very uncomfortable with that. In fact, I don't know him, but Dr. Scott Atlas, or not Dr. Scott Atlas, it's Dr. Jensen here in the United States, was very outspoken about that he was extremely uncomfortable with being told to do that. I mean, no, I wouldn't do it, actually. I would not lie on a death certificate for two reasons. It would be the wrong thing to do. And I have a healthy respect for the law enforcement system. I don't want to go to jail, right? I mean, so I think that most people disagree with this. A long time ago, guidelines, and I can't remember the exact year, but the World Health Organization and the CDC, they all have printed guidelines, published guidelines on how to fill out death certificates and when there are multiple causes of death, which is often the case. You know, you have to sort out, was it the heart attack or the diabetes that killed somebody, right? So there are guidelines for this. And then the instruction was to specifically ignore the previous guidelines, which begs the question, why would you do that? You have guidelines in place for years and years, and everybody uses them, and it tells you how to fill out a death certificate. Why would this, and it wasn't like we revised all the guidelines, here's the new version. It's just in this one specific disease, we want you to do this differently. It makes absolutely no sense at all. None of this makes any sense at all, and I don't know how thinking people can watch all of this and buy it. I mean, you know, we could be talking about the moon having green cheese and, you know, Martians living amongst us, and it would not be any more tall tale than what we're watching every day.
Yeah. It was something that tipped me off early on, because I'm taking some courses with you, and I was learning a bit about vaccines, and then I started researching viruses on my own before all this started. And it seemed to not make sense until you see like kind of what does make it make sense, and I'll ask you about that towards the end. But a lot of people are convinced when they hear on the radio that there's, what was it, over 200,000 some deaths in the US that were, they believe, from COVID, from what they hear in the media, and so many cases. So I wonder if we could talk about traditionally, what does a case mean, and what does a case mean nowadays when they're
Well, a case used to be somebody who's sick.
Yeah.
Okay. Now what we're doing, and I have a copy of the letter that's going out all over Ohio, is what, you know, the Ohio State University Medical Center and the Ohio Department of Health, and this is going on in every state, they send out letters, say, we're going to be in your neighborhood next week. And if we'll knock on your door, and if you're home, you can have a free COVID test. So you're sitting on your porch, drinking iced tea, and the COVID testers stop by and ask if you want a free test, and nothing wrong with you. You have no symptoms. You weren't going to seek medical attention. You're getting ready to go to work in a couple hours, and they show up and, you know, give you a test. And if you test positive, which could be, by the way, we can talk about the test, it's a fake test. Now you become a case. And so the reason why they're doing this is because you gin up the fear over the cases and how contagious this is. But who cares? If you're not sick, it doesn't make any difference. In other words, I could potentially be a case right now. I mean, I don't know. I'm not going to allow myself to be tested, but there's nothing wrong with me. So what value is there in saying, Pam Popper tested positive for COVID? She's fine. She worked 18 hours yesterday. She took a yoga class and did an hour workout in the gym, got up at 5 o'clock this morning and has been working ever since, but she's a case. What value is there in classifying somebody like me as a case other than to just scare people, which is the reason it's being done? And the only people it's scaring are people who don't have the analytical skills to actually think about this. Because if they did, you can't really look at very much of this and think and believe that it's true. I mean, it's ludicrous, just ludicrous.
So let's go into the test and the PCR and then the antibody test. And I know, like, what are they useful for, and why is it maybe inappropriate to use them to determine cases?
Well, the PCR test is probably the most egregious, and it's the one that's used the most frequently. Now, the person who developed this test is a guy by the name of Kary Mullis, right? He won the Nobel Prize for developing it. And so the first thing, and again, I don't think this is a great leap of, you got to be really smart to figure this out. But let's assume that the guy who invented the test knows the most about it. Reasonable assumption? Okay, he said it should never be used to diagnose anything. It's a lab tool. What it does is it amplifies tiny bits of something so that you can study it in a lab. All right, so if you had some fraction of a coronavirus or something and you wanted to blow it up so that you could study it, that's how you would do it. All right, so how much you blow it up is an arbitrary thing. Well, it depends on how small it is. It depends on what you're trying to do with it in a lab situation. So what they're doing is they're using a test that should not be used for diagnosis according to the guy who invented it. Now, why would you choose a test that's not used for diagnosis unless you're trying to it's a hoax, right? And let's call it what it is. So they're using the test, and then they determine the number of cycles. And so if you, and there have been studies about this, if you cycle at about 28 to 30 something, early 30s there, you get almost no cases, but you jack it up to about 35 or 36 and everybody becomes a case. You just test and you just, and of course, if you want to show that it's spreading like wildfire, you change the cycling even more. Now you might say, well, how do we know that's going on? There is misbehavior. I don't know how it is where you are, but here in the United States, in every single state, there has been testing misbehavior. And normally how it comes to light is not because the state is saying, well, we're spending all this money in testing, we better monitor. It comes to light when something so ridiculous happens that you can't ignore it. And the best example of all is the day that tens of thousands of tests from 18 labs in Florida all were positive. Now that is statistically impossible, okay? So what that tells you is something bad is going on. Now you got to figure out what it is. So Ron DeSantis, the governor of Florida, was the first person to say publicly on television, something is wrong. We're going to look into it. Everybody else just keeps on using the test. The Emperor of Ohio, where I live, apparently missed that press conference, or he probably amped it up to 60 cycles so that we can find even more people. He's desperate to close down the state of Ohio, so I'm sure he's amping every opportunity he gets. So that's the PCR test. I mean, it's just a joke, all right? That's like me saying, I'm going to go out and start looking at people, and anybody who has fingernails, we're going to diagnose them with something. I mean, you're just going to find what you're looking for, right? So the antibody test tells you if you have antibodies to it. And the reason why you would do that is to figure out the spread in the community. And the interpretation of this is that the more cases you get from that, the lower the death rate gets, because you find out that lots of people were exposed to this. In fact, we now know for sure that there were people in China who had this illness in October of last year. So when you think about it, by February, you had 44 people. By January 23rd, you had 44 people in Wuhan who had COVID-19. and it started in October. Well, my gosh, that just doesn't sound like wildfire to me. I mean, again, we could argue about the definition, but assuming that there was one in October and 44 in January, I just don't feel like putting on a mask and hiding in the basement over that.
I think one of the things people have been made most afraid of is the possibility that as an asymptomatic person, that you're gonna make somebody sick.
Well, you should hope that you are. The faster that's how you develop herd immunity. Okay. So what you want to do, if you found out I was COVID positive, what you want to do is come over here and let me sneeze all over you so that you can get it over with. Okay. When in the world, and I keep telling people, I want you to think back to last year during flu season. Were you walking around terrified that somebody buying bananas at the grocery store might be an asymptomatic carrier of the seasonal flu? I don't remember that. I'm 64 years old and I don't remember that ever happening in my lifetime. Okay. When Ebola came over here, we had a few people, they didn't act like this. This is just, it's madness. It is a psyop is what this is. This is a deliberate attempt. And it is out of Hitler's playbook. I know a lot about this. I'm a World War II buff, and I have a particular reason for wanting to know about this kind of thing. You, first of all, divide the people by scaring half of them that can be convinced to be frightened about something. And then you can do almost anything you want. And by the way, these self-righteous mask-wearing frightened people right now who don't have the ability to think through this. And I mean, I don't know what else to say about it, because, you know, you would think this is another thing too. If I had a deeply held belief about something and somebody respectable challenged, I listened, I said, maybe I should think differently about this. I would at least look into it. These people are so brainwashed, they can't even fathom looking into it. The idea of, because I hear from them all the time. And I say, show me the data. I'm willing to change my mind. I have told everybody this. Do you realize I have made myself a target of some very vicious people, all right? If I could change my mind and make that go away, I'd put on the mask and I would join you all. And not one of these people has been able to send me anything because they don't have anything. In other words, this isn't, they're not writing to me and saying, please look at this and change your mind. They're writing to me saying, you're a murderer. Really? Just prove it. Oh, I can't prove it. I don't have any evidence. All I'm capable of doing is being brainwashed and pointing the finger at people. So the bottom line is, here's what I'm getting at. That we're talking about the flu, and never in the history of civilization have we decided to do something this terrible to people. And it is all designed to weaken the population, separate and turn people against one another in order to gain control of the population and to do some pretty terrible things. And I've told people, if we have started doing the right things to get ourselves out of this, and we have to do this, because what these people have in mind to do next, it's going to make right now look like the good old days. Okay.
Yeah. And I think, one of the issues that could be brought up now is, with all this testing going on, even with the misreporting and the faulty tests, we have this great number of cases of asymptomatic people, but the death rate hasn't gone up. And
right.
I don't know, but that sounds to me like there is herd immunity possibly.
Yeah, good news. Good news.
What is the infection fatality rate that they've come across? And why
it's as low as 0.54%, which makes it milder than the seasonal flu. And the only reason that that's not being told is there's no interest, that the people behind this have no interest in you knowing that it's not as lethal. Okay. So they continue to lie about it, essentially. Okay. And they lie about it. At this point in time, they can't really lie about it the way they were before. So what they do now is they just keep the focus on the cases. And then every once in a while, somebody like Fauci will get up and make an openly asinine comment that herd immunity won't help us. Okay, you're the world's best virologist. I mean, I don't know where you went to medical school, but I have my immunity textbook, from college, you know, if you read the first 3 pages, you know about herd immunity, right? So this is just laughable on the surface. I mean, I guess it goes to the people should be laughing at Fauci, and some of us are. The president is right now, says he's a fool, and he is. And then other people, they're very impressed with his credentials. Well, I've never been impressed with credentials because some of the worst criminals I know in medicine had great credentials, have great credentials. So yeah, so we should be taking this increase in cases and no change in death rate as good news. Take off the mask, go out, enjoy your life, you know, stop being afraid, stop torturing your children. Look at what we're doing to kids. And I'll tell you why. I've never been a fan of people who abuse humans, but there's a special place in the wherever everybody goes after here for people who abuse children. Okay. The world, the karma, whatever you want to call it, is going to catch up with these people for that alone. And there are some of us who feel the same way about the criminals behind this that we felt about the Nazis. Till the end of our days, we will chase you to the far corners of the earth until you pay for what you did. Listen to me carefully, because I don't make idle threats. And I'm not the only person who feels this way.
And let's talk about the masks, because Hugs Over Masks here in Canada, their big focus is on the children, because a lot of kids who are going back to school, they've got to wear the mask all day long.
Which is ridiculous.
So what everybody talks about, we had like a radio program that's cross country, and they had an expert on and trying to address all of the stories against wearing masks, and trying to say, well, no, the science says that, you know, they're effective in this way and that way. Well, what does the science say for masks?
Well, the first thing is the science says it's the seasonal flu. And if they haven't put masks on kids for the last 50 years, why are we doing it now? I wish I was the person questioning these people at some of the press conferences, but you notice they don't let anybody in who asks those kinds of questions. If you actually are a reporter or somebody doing your job and you get a little too aggressive with asking questions, you will not be invited back. Only sycophants are allowed in the press room, right? That's the way it is here in Ohio. So that's the first thing. It's the seasonal flu. So why are we putting the people on masks on children? The second thing is children don't get sick. They don't die of it. Right now, there are thousands of times more children dying in automobile accidents than COVID. Now, what are we going to do? Tell kids they can't ride in the car or the bus or anything anymore? We don't do that, right? Well, that's a far bigger risk. So I think the first thing that you start with is, before you ever get into the fact that these masks are filthy and they don't stop the spread of the virus and all that, what the hell are we doing? I think is the first question we ask. But beyond that, the first thing about this is that until the government changes its websites all the time to make sure that the party line is held to. But I have screenshots of OSHA's website when it had the instructions that if you are working, for example, in a laboratory, and for safety reasons you have to wear a mask every day, the first thing is you have to be medically cleared to do it, just for 8 hours, all right? Because it's dangerous. Everybody knows it's dangerous. So if you have high blood pressure, if you have asthma or whatever, that's a bad job for you to work in a place where you have to wear a mask all day long, right? So that's the first thing, and we're putting it on everybody. The second thing is that the type of mask that would keep the virus from spreading has to be tightly fitted. This idea of some bandana type of thing around your face is ridiculous. Has to be tightly fitted. You can't have a beard or anything like that. Well, kids don't have beards, but the adults wearing the masks aren't protecting the children because the masks are all ridiculous anyway. So anyway, you have to be medically cleared, and then you have to wear a particular type of mask, and the masks that people are wearing do not stop the transmission. The cloth ones are the worst. You actually transmit more with the cloth. So this is a plan to make people sick. I mean, we wouldn't have a problem if we left all the kids alone and the adults without masks, but we'll probably make some people sick with the masks, all right? Now, here's the next problem that you have with this all-day mask wearing, all right? Because if you're wearing a mask in a lab, for example, you take it off and then you don't put that mask back on. And if you're wearing it in a surgical situation, it's not to keep viruses away, is to keep bacteria out of open wounds, right? So that even the reasons why masks are used in medical facilities is completely being distorted. But here's what happens when people wear masks all day long. Let's just take me, for example. So theoretically, I'm breaking the law because I'm supposed to be wearing a mask here in my office. There's nobody masked in this building, just for the record. I don't care, all right? So here's why I don't want to wear a mask and why people in the building aren't wearing a mask. So right now, you can't understand me if I don't take the thing off, all right? So I got to pull it down to talk to you, and then I pull it back up. And then I got to pull it down to drink water, and then I pull it back up. And then I got to pull it down to eat my lunch, and then I pull it back up. Okay, now what am I doing in between? Well, over here we have a phone. Do you know how many people answer this phone in this office when we're having a meeting or whatever? It's been touched by I don't know how many people. So I'm picking this up. Here we've got writing utensils. Everybody comes in here, they're making a note and the whole nine yards. How many people touch these? I don't know, lots of people. We have computer mouse that other people come in here and use this computer. We have documents. I've got files. I go back and get in the filing cabinet and then I'm touching it. So what am I doing? We tell people every year during flu season, keep your hands away from your face, right? So what we're doing, when I tell you that they're trying to make people sick, we are actually causing people to touch items touched by all kinds of people, and then their hands are by their face all the time. So I refuse to make myself sick by engaging in this behavior, and I will not allow the people who work here to become sick by engaging in this kind of behavior either. So, and for the record, I don't wear a mask any place I go. I don't. I won't. To me, it's a sign of submission, and I won't submit.
So people find it difficult to believe that, like, they think, you know, government officials, yes, they're corrupt, but when it comes to something like this, they believe that their government, the World Health Organization, the media, and the health professionals, that they would not lie to them about something that would be.
Oh, they've been lying to us for years. Let's just dispel that myth. The first thing I want to tell you is that when people say, I believe government's corrupt, but not in this case, okay? Listen, I had a boyfriend once that cheated on me about 3 dozen times, okay? What do you think is the likelihood he's not going to do it a 37th time? 0. That's why he's gone, all right? When people violate your trust, you stop trusting them. Again, the mental deficiency it takes just to make that comment. I know they lie to us all the time and they're corrupt, but not this time. Would you accept that from anybody else? This is insane. The medical profession has been careening out of control, as you know from the classes you've taken here for a long time. And the best example recently that I can use is the opiate epidemic. The reason we have an ongoing opiate epidemic in the United States, it's about 10 or 20% the pill mills. You know what really caused it? Pretty girls who used to be cheerleaders in high school went to work for Purdue Pharma, and they called on doctors and said there's an epidemic of untreated pain in the United States, and OxyContin isn't addictive. And 250,000 doctors said, okay, and they started writing script. And when you have a group of people who are persuadable like that, they've been persuaded to do terrible things to people. For as long as I've been in this field, I've been ranting about this, okay? We have chemotherapy drugs in the United States that do not extend life by a single day, that bankrupt, the co-pays bankrupt people, and they're prescribed every day in university medical centers. Now, what kind of a person does that? A despot, all right? So we think that they're going to behave differently about this. These are people who are dutifully following instructions from people who orchestrated this. They do not have your best interest at heart. They've been lying to you and hurting you, if you're in Canada or the United States, for decades. I've been speaking out of it. You can go watch my videos from 25 years ago. You can read my articles from 25 years ago when I started in this business. I've been talking about it. All that we've seen now is this is just blown up bigger. This has all been dress rehearsal for something cataclysmic. And they knew they could get away with it because they've been getting away with it for years, right?
And actually, I want to say, like, for my audience, Pam has done so much research into this, and her classes are amazing. And when I started, I just thought to myself, I have so much catching up to do. So I've been like doing all of your advanced study ones as much as possible, reading the books when I can't take the class. But look into her classes; it's well worth it. And her YouTube videos, they're free. Go and view them. So you've done a lot of research into healthcare and the histories of different aspects of healthcare, which I
Mhm.
find, paints that bigger picture. Um, and I wonder if you could just go into a little bit more about the histories and what you found, what it taught you, and why we should all be good researchers on our own and critical thinkers.
That's a great question, and it's important for the bigger picture, not just this episode, right?
Mm-hmm.
So the first thing, there's a great book called the Social Transformation of American Medicine by Paul Starr. It won a Pulitzer Prize in 1982 when it was written. And it's about, and it has relevance for every country, not just the United States, because many countries, the specifics and dates and stuff would be different, but the same thing happened, right? And it's about how the medical profession got control of healthcare in the United States. It's about how the hospital systems developed and how the insurance schemes developed. And those things affect everybody everywhere. So the reason why medical doctors got control of medicine in the United States is not because citizens thought it was a good idea. Citizens hated doctors. The average medical doctor at the turn of the 20th century made less than the average postal worker. That's how much people hated doctors in this country. They liked herbalists, they liked homeopaths, they liked the lady down the street who mixed up teas and that sort of thing, like my grandmother used to do. When we was, I don't know what the heck she gave us when we were sick, but it always made us feel better. It didn't come from a drugstore, I can tell you that, right? So, so anyway, but doctors decided to make themselves a wealthy profession. And some of what they did was good, I have to say. They said we're going to have standardized education and we're going to have residencies, and so it wasn't all bad. But essentially getting control of medicine, basically saying it's going to be us and nothing else, that was bad and it was planned. And people were not happy about it, but they did get control of medicine. Okay, so the first thing, and this has not happened in most other countries. Like in Germany, what we call Western medicine did not crowd out everything else. It certainly didn't happen that way in China, but here in the United States, it did. But I think the big thing is that doctors all over the world, some version of this happened, by the way, and then doctors all over the world started convincing people that medicine is so complicated that you can't understand it, so you therefore must follow instructions. Okay, now, if this even this takes a mental leaving your senses behind, because all day long or all of our lives we buy things that we don't have a great understanding about. We somehow function. I could not build a house if my life depended on it, but I have managed to buy them and live in them and even make some money on a couple of them. Okay, made a lot of money on the house I'm living in right now. And I couldn't build it but somehow I managed to do that, right? I do not know anything about how a car operates. I have been buying and leasing cars for 40 years. All right. How did I do that? I am not a financial planner or advisor. I do not understand the Dow Jones Industrial Average entirely. I have retirement accounts. How did I do that? Right. Okay. So we manage in every other aspect of our lives, we have some understanding that we must take responsibility. Like I am responsible for my retirement account. I'm responsible for buying a car. Nobody says, I'm so stupid, just tell me what to drive, right? We have to look into it. And so we investigate enough to make smart decisions. And then we completely lose all of that, walk into a doctor's office, and a doctor says, you need this $80,000 procedure. How about next Thursday? And people go, okay, right? You would never do that. So one of the things I've been talking about for the last 25 years, it's actually the focus of our business here, is you need to start doing the same thing when you buy healthcare, diet advice, supplements, drugs, procedures, whatever it is you're considering. that you do when you buy anything else, where you investigate. And of course, the obvious exception is if you're in a car accident, your head is open and bleeding. You don't really want to do any checking into it then, let them fix you. But the vast majority of healthcare is consumed on a voluntary basis, where there's certainly time to look into something before you consent to it, right? And so if people were to do that, and that's what we do here is show them how, and by the way, the reason that nobody else is teaching you this is it dries up interest in a lot of things. In other words, when people look at the outcomes, going back to what I said about cancer treatment, if you knew that your copay was $10,000 and it wasn't going to help you live an extra day, you probably wouldn't sign up for it, would you? So it's very important, actually, that you not know that, which is why, and I don't think that oncologists, for example, show up at the office and say, I wonder how many people I can deceive today. But the culture of medicine is not certainly disclosure. It's not collaborative. It's not, there's nothing required. I mean, if you're in the mortgage business in the United States anyway, and you don't fully disclose to people everything, you go to jail. In the healthcare business, you can disclose nothing or outright misrepresent it. Nothing bad happens to you, and that certainly needs to change. But I'm an advocate for people taking ownership of their decisions, which they're generally willing to do. That's not an outside the box idea. Just apply it to this, which most people have not done. That's what I'm proposing.
Yeah. So I wonder to touch on for our last topic, let's go into the lawsuit that you're involved in, which I think is really great. I've actually sent an email to all of our government officials here with the 627 supporting documents to, make everybody aware. Let's go into that and the website you put up, Make Americans Free Again, what people can find there, and your new book that's available, COVID
Yeah,
Operation.
the new book is out. It's on Amazon, and we're building a platform to make it available for people in other countries because there's some issues. Everything's being censored now, including books, and that should tell you something. Yeah. That why that doesn't alarm people is amazing to me, right? But anyway, so I started this organization called Make Americans Free Again. Originally started doing the planning work for it in June. We launched it in July 7th. And the reason is that I think the metamorphosis that we all went through, this process was, I didn't agree with the lockdown in March, but okay, 2 weeks to figure it out. We can recover from 2 weeks of anything. And then it started getting longer. And I think that by May, we all realized they're never going to stop. It's going to get worse. They're going to keep doing terrible things and all that. So we basically said we have to do something proactive. So we started this group, and we have short-term, medium-term, and long-term goals. All right. The short-term goals that we worked on, because we launched on July 7th, is that it goes back to this discussion we were having about kids and masks in schools. What the heck are we doing, right? Schools have become dystopian environments that are unsafe psychologically for children. So we set up this huge, good friend of mine from Arizona set up this huge homeschool resource center. Parents it's literally a one-stop shopping thing for parents who want to homeschool their kids. And we have private coaches and people to help with that. So we focused on that because that was an immediate need. And that continues now because what a lot of parents did was send their kids to school. And then they found out, my gosh, this isn't a really good environment. My kids are crying and all that. So they're pulling them back out again. So anyway, that was one of the short-term goals. Medium-term goals were lawsuits, which I'll come back to that in a minute. And then the long-term goals, there are two. One is to work on the forced vaccine issue, which requires gathering huge numbers of voters and then dividing them by individual state legislative district. Our system is a little bit different here in the United States than some other countries, but and then working on having the votes to take out pro-vaccine politicians, which this has never been done before, where you just basically sit down and say, what we're going to talk about is a numbers game. You won your election by 2,300 votes. We have 17,000 people in your district. I don't know how much money the drug companies give you, but it doesn't really matter because I have enough votes to get rid of you in the upcoming election if you will not sign a pledge, smile for the camera, and say that you're going to vote against this kind of nonsense, or you're going to vote to repeal mandates. And And so it's a massive project, but it's never been done before. I'm financing that myself, by the way. And then another long-term project, a two-pronged long-term project is cleaning up the devastation. This will be much like cleaning up after World War II. And what I mean by that is, first of all, we've just decimated small business in this country. Some of us have been able to help some small businesses to stay in business by becoming very proactive. Like I own a food company, and I've been ordering food in, which I have no reason to do. Food is down the hall, okay? But I've been doing it like 3 nights a week, basically, to help restaurants stay in business. So what we want to do is put together teams of people who are experienced in business. I've also done some of this already to renegotiate leases, help get businesses open again, get people to patronize. Like, for example, if I knew that a group of businesses or a group of business owners and advisors were going to rescue a flower shop here in Worthington where I live. Okay, so this guy owns a flower shop. He's been closed and now he's going to reopen. How many flowers do you have to send to get on your feet? Okay, well, I'll send flowers to everybody I know in Franklin County. Okay, I mean, I can't do that times 3,000, but if I do it and some other people can do it, we can collectively, I have confidence in Americans and their willingness to do that. And then the other problem that we have is that economically disadvantaged children, thanks to these criminal despots, they are now functionally illiterate. And so we've looked into it enough to know that it will work and we're going to do it. We're going to put together retired teacher groups to use churches to withdraw these children from public school once and for all and get them the best education possible through a version of homeschooling. And all free. Church donates the space, retired teachers do it for free. All the parents have to do is notify the local failing school system in many cases. You've taken this too far. My kid wasn't doing well before you did all this nonsense, and I'm done. And I think we can go into the economically disadvantaged areas and start saving these children from what has been done to them. And by the way, that loving church environment we're going to put them in will go a long way in overcoming the psychological damage that's been done, where children now think the environment is unsafe, people are unsafe, and they walk around thinking that a virus is going to come out of the sky and kill them and their families. We have a lot of work to do to help these children recover from that. So that's what we're doing. Now I want to come back to the lawsuit. There are many groups in Ohio. One of the things I think that we've done here in Ohio that's a good model for people to look at is that Ohio Stands Up, Make Americans Free Again, Ohio Health Freedom. There are a bunch of groups who've come together, Hugs Over Masks. Everybody says, look, we've got our own different groups and we don't really want to lose our identities. We're doing good work at the things that we're doing, but we have one thing in common. We want this problem over with. So we're all working on this lawsuit, contributing money, expert witnesses. I mean, it's an amazing collaborative effort. Jason Hedges, who's the founder of Ohio Stands Up, is the person who kind of got the ball rolling. And we'll owe him, I'm going to make sure he's taken care of in my will. This guy's a great guy. But anyway, Ohio Stands Up kind of started, and we joined in, another group started joining in. And I thought for a long time, and was actually having a lot of conversations with a guy who became a friend of mine in Florida, who's a retired trial lawyer, a real smart guy. And we were watching all these lawsuits fail. And what essentially was happening is that people were walking into court and saying, my constitutional rights are being violated. They are where you are too, right? True story. The government comes in and says, oh yes, but it's an emergency. And then the judge says, oh yeah, well, there's that, right? So it gets thrown out. So we were the first people who filed a lawsuit that said, it's not an emergency. Because if your claim is it's not an emergency, the other side can't come in and say, it's an emergency. They actually are going to have to prove it. And they're squirming. I mean, it's the usual procedural nonsense that we're going through since we filed on August 31st, but this is giving them a lot more trouble than the other ones, which were pretty easy to dismiss. We're going to get ready we filed in Ohio in federal court. We are going to file in another state within the next few days, probably maybe even by the time people see this video. And the idea is to file in every affected state And there are a couple of reasons for it. Number one, people in all areas need rescuing, and some more than others. I mean, Ohio is a terrible, terrible place to live, but our ruler is not quite as bad. He's trending that way. He gets worse every day. I don't know what's happened to him, but he's really just nothing but a criminal despot. But in some other states, it's worse. So these people need relief. But the other thing, the more of them you file, the less likely it is that it'll just go away. So if somebody's case gets dismissed, well, you can file it again, but you got 40 others proceeding through the court system. And we know that the eventual goal is United States Supreme Court, and then that's going to affect everything, not just this episode, but one of the things that we're looking toward is under what circumstances in the future can you declare an emergency, and who gets to do it, and how long can they do it before there's some kind of participation from other people or agencies, and who would those be, and what would, that all needs to be spelled out, because there's nothing right now to stop the next person from saying there are more traffic fatalities and we're just going to take all the cars and trucks off the road till we figure it out. I mean, we'd all be dead from starvation. The food supply, there would be no food supply if that happened, right? So anyway, that's our strategy. That's what we're doing with lawsuits. We have a marvelous attorney, real unusual person to take on something like this, but the right person to take it on. And so that's what we're doing.
I think I looked at his website. That's Tom Renz.
Yes.
It was one of his mentors in the Nuremberg
yes
trials.
Yeah.
That was
And
really
that's what it takes. It takes somebody who this type of this is another problem with a lot of the lawsuits that have been filed, and this may be valuable for your listeners too. Okay, so a couple things about lawsuits. The first thing is a lot of well-intentioned people who have some knowledge about the law and are lawyers are not necessarily the best lawyers to file this lawsuit. Okay, so you get a lot of administrative law people and that sort of thing. Well-meaning, want to help, but they're just not equipped to do what Tom knows how to do. So it'd be kind of like saying, well, Pam, you know a lot about health, and gosh, I've read some of your papers. You're a great researcher. Can you take my appendix out? Actually, I probably could. Okay, I mean, I know where it is, and I watched a lot of surgeries, and I did go to school and work on cadavers and all that. But having said that, I just don't think it's what I should be doing. And so don't call me about that. Okay. All right. So that's the thing. First of all, we have a problem with attorneys. I think the second thing, wrong claim made in court. The third thing is that the attorney who takes this on will have an understanding of what's involved and will demand, like, I don't think Tom would have taken it seriously if Jason hadn't had the beginnings of an organization where he said, we'll come up with the money, because Tom knew you can't do this like at 4:30 when the rest of the day is over. You spend a couple of hours on it. The guy hasn't done anything but this since like the early part of the summer. So he really understood this, had trial experience, worked for somebody who was involved with the Nuremberg trials, and was kind of a legal nerd in law school, which is really the kind of person you want, because one of the things that he's done is he's uncovered a lot of precedent that nobody else has cited before. There is a case in the United States Supreme Court that was decided, and one in the state of Ohio, both of which go to limitations on declarations of emergency that nobody's citing. So he's an unusual guy, and if you're thinking of that, you want to file, first of all, being quick to do it is not the objective. It's being effective, finding the right attorney, and then having the right infrastructure, because the right attorney who really understands what this is all about is going to say, here's what I'm going to need in order to be able to do it. And then you need to be able to come up with the money and the infrastructure to support it.
And just before we go, because I know we're like at our end here, is there anything you could tell us a little bit about what we might find in your book, COVID Operation?
Yeah, what I tried to do, I think that the biggest thing, people are bombarded with information about this. The sheep are bombarded with wear your mask and don't ask questions and go to the basement and wait for instructions. And I don't think we're going to reach them. The people who have been thinking about this critically, they're bombarded with information, and it comes in bits and pieces that become difficult to assimilate. And so what I felt and my co-author felt is that we needed to tell the story of this. Like what is happening? What do you make of it? how did it happen? What are the influences on what, because we can learn from this experience if we can look at it comprehensively. So it goes to how it began. The germ of this started in 2010, maybe earlier, but the first evidence that we have that it was really being thought about was 2010, and then goes through what's happening and the consequences of it, and then what this means for our future and what we should do about it. I think it ends on a fairly positive note, mainly because that's the way I like to live my life, and that's the way my co-author and his family live their lives too. So it ends on a fairly positive note, but one that it clearly says we all have to take responsibility and become active. But I think, and engaged in this, but I think that the person who's just basically saying, I'd like to read something that's fairly entertaining, and I think we did that, but that just tells me what I need to know so I can figure this out. I think it's a good book for people like that.
Yeah, yeah, perfect. And everybody can find it on Amazon now, and you might be able
Yes,
to ship it to
and
other
watch my
countries
video
later.
clips. pampopper@msn.com is my email address. I will make an announcement next week in video clips as soon as we have this website set up so that people who are blocked in other countries, I know that it's blocked in a few other countries, can log on to this website and download it to their computer or tablet or whatever they're reading from.
Okay, perfect. Well, thank you for being here with us today and giving us all this information, covering the foundations of, I think it's so important to address those very basic questions at the beginning, because all the rest is just kind of noise afterwards.
Yes,
If you don't get those very basic things, then all you get lost and
right,
overwhelmed. And I think it's
exactly.
kind of intentional that it's
Yeah,
set up that way.
yeah.
But thank you for your time, and we'll hopefully get you on later.
All right, happy to do it. Thank you for having me.